Now let's talk about other life-threatening emergencies. BLS providers and bystanders may face to respond to life-threatening emergencies that have not yet progressed to cardiac arrest. Some of these emergencies are heart attack, stroke, drowning, and anaphylaxis. Let's start from heart disease. Heart disease is the leading cause of death in the United States for both men and women, with a heart attack occurring every 40 seconds. A heart attack happens when a blood vessel is blocked or undergoes a severe spasm, restricting the blood and oxygen flow to the heart muscle. Although the heart may continue to beat, delayed treatment increases the risk of the permanent damage or abnormal rhythms that can lead to sudden cardiac arrest. Symptoms may be intense and sudden or begin gradually, including chest discomfort, which sometimes by patients or by victims is described as pressure, fullness, squeezing, or pain that may come and go. This feeling can also occur in the arms, shoulders, neck, jaw, upper back, or stomach, often accompanied by shortness of breath. Other signs, including cold sweat, nausea, vomiting, or lightheadedness, all of which require immediate medical attention, can happen. And you can see a little graphic images, gross heart cut images, and we can see the area where the infarction occurred. The typical signs of the heart attack are mostly seen when the patient is white, middle-aged man. Women, the elderly, and people with diabetes are more likely to have less typical signs of a heart attack, such as shortness of breath, weakness, unusual fatigue, cold sweat, and dizziness. Please remember this for exam. Women who report chest discomfort may describe it as pressure, aching, or tightness rather than as a pain. And other less typical signs are heartburn or indigestion, an uncomfortable feeling in the back, jaw, neck, or shoulders. And it can happen with nausea or vomiting. I want to ask you a question. What do you think? Heart attack and sudden cardiac arrest, is it the same or no? People often use the terms heart attack and cardiac arrest to mean the same thing, but they are not the same. A heart attack is a blood flow problem. It occurs because a blockage or spasm in a blood vessel severely restricts or cuts off the flow of blood and oxygen to the heart and muscle. And sudden cardiac arrest is usually a rhythm problem. It occurs when the heart develops an abnormal rhythm. This can cause the heart to shake or stop completely and no longer pump blood to the brain, lungs, and other organs. Within seconds, a victim who was conscious can become unresponsive and can stop breathing and start gasping. And death can occur within minutes if the victim does not receive immediate life-saving treatment. Heart attack happens more frequently than cardiac arrest. Although most heart attacks do not lead to cardiac arrest, they are a common cause. So early recognition is very important, and early transport of someone with a suspected heart attack is very critical. Many people won't admit that their discomfort may be caused by a heart attack, and sometimes people they're concerned, they are saying that they're healthy or they are too young for a heart attack, they don't want to bother their family members, they don't want them to worry about them, or they don't want to go to doctors, physicians, they don't want to see them. So it is very important to understand the importance of early interventions, and if you suspect someone is having a heart attack, act very quickly and activate the emergency response system. Do not hesitate even if the victim or the patient does not want to admit the discomfort. Now, what should we do? Heart attack is a time-critical emergency. Every minute counts. First, have the victim or ask the victim to sit and remain calm. At the same time, try to stay calm yourself. Activate the emergency response system. Follow all the rules that we learned and discussed. If the victim is responsive, ask to chew or swallow aspirin unless they have a known aspirin allergy or have been told not to take aspirin by a healthcare provider. If the victim becomes unresponsive and is not breathing, what should we do? We need to start CPR with all the rules that we learned. Once again, remember, time is muscle. Every minute counts. The longer a heart attack victim waits for treatment, the more damage to the heart muscle will occur. One common intervention is non-surgical treatment in the cardiac cath lab. Administration of an intravenous medication in the ED is another intervention. Actions during the first several hours of a heart attack determine how much the patient would benefit from treatment. And our goal is to decrease time from symptoms onset until the blockage is resolved.